HIV/AIDS is a disease that affects at least 1.1 million people within the U.S., but it is estimated at least 1 in 7 of those people are not aware that they have contracted HIV. According to the CDC, there are almost 38,000 new cases each year, but slowly decreasing. What is HIV and AIDS, and why is it so deadly? HIV stands for Human Immunodeficiency Virus. It's a disease that attacks the body's immune system, more specifically the CD4 cell, which coordinates the immune response by stimulating the other immune cells. What makes it so dangerous is the fact that it can't be cured and people can be asymptomatic until it reaches AIDS. The sooner it's recognized, the sooner it can be treated and suppressed. Once it's gotten to AIDS stage, the human body has almost no defense against any opportunistic infections or cancer. There's currently a treatment called ART, or antiviral therapy. It isn't a cure, but it helps suppress the virus. While HIV and AIDS is not a discriminatory virus, we do see there are groups of people more susceptible to getting it, either due to lack of education or lack of access. According to the CDC and research from 2008 to 2014, they found the demographic that has the highest rate with HIV and AIDS were gay, bisexual, African Americans, followed by heterosexuals, drug users that inject, and then gay and bisexual male users that inject. In one of the studies, they analyzed with the socioeconomic status of those that had HIV and AIDS. They found that there were a large disparity between those living in poverty versus those living in middle class or above areas. Most of the people that go to jail or prison are those of lower socioeconomic standard and are disproportionately African Americans. So in regards to the data that the CDC has collected, we see that there is a high possibility that many of those going into jail and prison are already infected with HIV or AIDS virus and either don't know or can't afford the treatment.
While in prison, many inmates participate in high-risk behaviors that increase their chance of spreading or receiving HIV or AIDS. This includes tattooing, illegal use of injectable drugs, consensual sex, sexual assault, and rape. The meds that are prescribed to patients individually can cost anywhere between $502 to $4,302 per month. The total cost for treatment, according to the CDC, was about $19,912 annually. The most recent published estimate of lifetime HIV treatment costs about $379,668. In a study performed by Bernadette Raboy and Daniel Kopf, they found the average annual income for prisoners by race prior to incarceration. In total, the average for males was about $19,650, and for women, it was about $13,890. If we look at the 2015 poverty guidelines for the 48 contiguous states and the District of Columbia, we see that on average, those that were incarcerated were barely making minimum wage, if at all. Now that they have been incarcerated, they've lost their job and health insurance. While in prison, they should receive the antiretroviral therapy, or ART. But once they're released, they no longer have insurance to afford ART, nor do they have the assistance provided by the jail. They have the right to file for Medicaid, but Medicaid has the right to deny them requests. Without insurance or any form of financial assistance, those that are seeking help can't afford it. While in prison or jail, ART should be provided to inmates that have presented as HIV or AIDS positive. While prisons and jails are not the most ideal locations to get the treatment, it does provide the structure needed. The meds that are prescribed to the inmates must be taken daily on time, similarly to birth control. Unfortunately, once the inmates have served their time in prison or jail, they are no longer provided the medical assistance. A study done by Malloy, Montaner, and Wood showed that when inmates were provided medical care and connections after they were released, they were more likely to continue getting help than those that were provided no assistance after release.
Fulton County Jail did a demonstration for 3 months where they were requiring a phlebotomy and conventional testing. This demonstration yielded a positive result, increasing the acceptance of HIV testing by 49% to 64.3%, when routine rapid HIV testing of oral fluid rather than conventional testing was offered. Previously, the acceptance rate had only been at 43.2%. We also see that the CDC has funded selected state health departments to conduct voluntary rapid HIV testing in jails. They have also supported Project START, which is an individual-level multi-session intervention pre-release program, and funded Project POWER, which is an HIV intervention among women in state correctional facilities. They have found that both projects have shown a decrease in risky behavior by both the men and women. Recently, a few prisons have made free condoms available to prisoners. There are very few things that we can suggest that has not already been done to help those with HIV within jails and prisons. But we do recognize that testing and education is a very important step in helping decrease the rate of new cases. We believe it would be in inmates' best interest if prisons and jails incorporated regular testing, ART, and consultation with HIV specialists, aka DART. We also see the acceptance rate of HIV testing increases when it doesn't take a long time. So rapid oral fluid testing is recommended over the conventional blood testing, but we do not suggest completely eliminating conventional testing. The end of HIV/AIDS shouldn't start when it's already too late. It is important to inform both prisoners and staff about HIV and other infectious diseases. The prison system should have well-designed programs in all prisons. Where possible, education delivered for prisoners by the prison system should be supplemented by peer education programs. But the education shouldn't start in places like jails/prisons, where in most cases it's too late. Education and peer-led programs should be available for those within lower socioeconomic areas, considering those in that area are at highest risk for contracting the HIV/AIDS. Making information and testing for HIV/AIDS more convenient for those who can't afford it could be an early intervention that could save many lives.